Dear colleague, welcome to this lecture regarding how to mount the Lexel Stereotactic frame. We strive for a symmetrically placed frame. A frame placed symmetrically on the head without roll or yaw and fairly parallel to the AC/PC plane has several advantages. Often you can use the same Z and Y coordinates on both hemispheres and can thus avoid changing these during surgery. Previously, before the introduction of navigation systems, it was very valuable to have the AC and PC on the same image. Further, an asymmetrically mounted frame would result in unusual sections for the target structures, making visual identification of the target more difficult. This is also true today if your navigation system should malfunction and you need to calculate the coordinates manually. Today, even though we are reformatting the images according to the AC/PC plane, it is probably beneficial regarding accuracy to minimize the degree of reformatting necessary. If you want to relocate the electrode during surgery due to lack of effect or stimulation-induced side effects, you can do this without recalculating the target coordinates with the navigation system. If the frame is well placed, then a change of the X on the frame will simply be a change of laterality of the target in the brain, etc. If the frame is not symmetrically placed, then a change of the X-coordinate will not equal the same change in laterality in the brain and might further affect the depth and anterior-posterior location of the brain target. Before mounting the frame, we shave the head of the patient if we do not intend to keep the hair. We mark the line between the upper border of the tragus and the lateral canthus on each side. This is roughly parallel to the AC/PC line. We put the patient in a half-sitting position and tilt the head gently forward into a straight position. Make sure that you have enough space behind the neck for the placement of the frame. The person holding the head should not interfere in any way with the frame. This is best achieved if the person is standing on the side of the patient, supporting the neck with one hand and the chin with the other hand. Take the frame and the cloth around it. Put it over the head of the patient and lower the frame so that the earplugs are at the level of the meati. Give the cloth to a second assistant. The assistant should keep the band straight up from the head. The assistant should not apply any pulling force to the band, but keep it slightly slack so that you can maneuver the frame. Make sure that the band is straight on top of the head. It is best to use the grip seen above when applying the earplugs. Once the earplugs are placed in the ear, this grip allows you to easily slide the frame from one side to the other by pressing with the thumb and pulling with the other fingers on the side you want to approach. The frame is therefore easily centered. Note also that you can easily hold the frame in place with one hand. Start with putting the right earplug into the meatus. Make sure that it is inside the meatus itself. Keep the earplug in place by pressing it into the meatus with your right hand and remove your left hand from the frame. With your left hand, insert the earplug on the left side. Now press with the thumbs and pull with the finger in order to tighten the frame as described on the previous slide. You will attain the most secure position by moving the frame a few millimeters in an anterior and superior direction. Slide the frame from one side to the other. Use the markings on the earplugs to obtain the same laterality at both sides. At the same time, rotate the frame parallel to the line between the upper tragus and the lateral canthus. Ask the second assistant to tighten and pull the cloth upwards. Now remove your fingers from the frame to the earplugs and rotate them simultaneously in opposite directions in order to lock the frame. Continue by pulling the frame upwards and tighten the cloth. Pull the cloth in an anterior or posterior direction in order to align the frame with the line between the tragus and canthus. Lock the cloth with forceps. Before applying the screws, check that the posterior part of the skull is not protruding over the posterior edge of the frame. Should this be the case, the MR indicator box cannot be applied. Check further that the screws are not placed where they might glide along sloping parts of the skull, that the frame is reasonably well aligned, that the frontal bars are not pressing against the forehead, and that the frontal piece is not pressing against the nose. Choose the fixation screws you believe to be the correct length and insert them in the frontal fixation posts. Insert them until they touch the skin. In the front, there is no problem if the screws are too long. Therefore, 2 cm or more of the shaft may remain outside the post when the tip touches the skin. Correct the length of the screw if necessary. Then insert the posterior screws in the same fashion. If these are too long, the patient cannot be placed in the MR coil. In skinny patients, 1 to 1.5 cm should remain outside the bar when the tip touches the skin. In fat, 1.5 to 2 cm. We then inject about 2.5 milliliters of local anesthesia at each screw. Make sure that the entry point of the needle is directly under the tip of the screw. In this manner, a possible hemorrhage will be stopped when inserting the screw. Deposit some of the fluid directly under the skin and the rest when reaching the bone. Tighten 2 diagonally opposite screws at a time. It is not necessary to turn the same number of turns. It is better to turn as many turns as you can using a certain force. Change frequently between the pairs. In this manner, the frame will retain its position on the head. First use the hands and then change to the screwdrivers. You should fasten the screws as hard as you can using 2 fingers. If you use more force, you might cause distortion of the frame. Now remove the cloth earplugs and earplugs holders and put the patient in a supine position. Let us now look at a video on how to mount the frame. We put the frame over the head of the patient and lower it so that the earplugs are at the level of the meaty. If necessary, change the position of the earplugs from the middle to the lowermost hole of the earplug holder. Put the earplugs into the meaty. Now press with the thumbs and pull with the fingers in order to tighten the frame and slide it from one side to the other. Use the markings on the earplugs to obtain the same laterality on both sides. At the same time, rotate the frame parallel to the line between the upper tragus and the lateral canthus. Rotate the earplugs simultaneously in opposite directions in order to lock the frame. Tighten the cloth and lock it with forceps. Align the frame with the line between the tragus and canthus. Choose the fixation screws you believe to be of the correct length and insert them in the frontal fixation posts. Insert them until they touch the skin. In the front, 2 cm or more of the shaft may remain outside the post when the tip touches the skin. Insert the posterior screws in the same fashion. In skinny patients, 1.5 to about 2 cm should remain outside when the tip touches the skin. Inject about 2.5 milliliters of local anesthesia at each screw directly under the tip of the screw. Deposit some of the fluid directly under the skin and the rest when reaching the bone. Tighten 2 diagonally opposite screws at a time. It is not necessary to turn the same number of turns. It is better to turn as many turns as you can using a certain force. Change frequently between the pairs. In this manner the frame will retain its position on the head. First use the hands and then change to the screwdrivers. You should fasten the screws as hard as you can using 2 fingers. If you use more force, you might cause distortion of the frame. Finally, remove the cloth, earplugs and earplug holders and put the patient in a supine position.